Dear listeners, welcome to the Health documentary by David Rubale from the Radio, Television and Film Center in Rubaga, Kampala, Uganda. Today, we are going to share and investigate the impact of TB, HIV, AIDS and malaria on the darling society of our land. The trio, TB, HIV, AIDS and malaria, has left at least every family or home share their fateful catch. Many families have lost their loved ones to any of the killer disease above. Lamentation and mourning are always the normal echoes in Mulago National Referral Hospital. During our tour in this hospital, the children wards were filled with many malaria patients. The heavy rainfall during our research in Mulago Hospital did not hinder us from meeting one of the doctors serving therein. Dr. Mathias Matovo, a medical practitioner and graduate from Makerere Medical School, situated in Mulago Hospital exactly, had this to share with us about TB, HIV, AIDS and malaria.
Tuberculosis as an infection, we find that in a private practice, many people are coming with complaints of cough, usually which we can regard generally as respiratory infections or respiratory conditions. They have treated with antibiotics, or more so are seeking more antibiotics or stronger antibiotics to work on their cough, usually which has not shown response. And we at times first introduce them to the higher generation antibiotics from one class to another, from penicillins to the other higher antibiotics, whereby again seems no change. But when we regard with the symptoms, people are coughing, has difficulty in breathing, though that one we cannot finally judge on it. Then usual night sweats are on, the sputum is thick, if it's expectorable, dark, and with times traced with blood. Then we recommend these patients to take a test, a sputum culture test, or a Ziehl-Neelsen smear test, which usually come up positive when they are referred to the referral health centers, both public and private facilities, and then we recommend them to start anti-TB treatment. Many people are not expecting to have TB. They think it is a very big disease, a very big burden to have, very big thing to have, and so keep on treating, or not believing themselves that they can have it, which is again further accelerated now to merge in HIV, which is whereby the person's immunity is suppressed. Anything that comes on can progress to a very serious infection or condition. TB today is driven mainly with the HIV, and we have found that very prevalent, very common. People come with the other complaints, skin rashes, skin conditions, but also had a previous 3 months history of a cough. And to do an RCT, that's a test for HIV, counseling and testing for HIV, you find that this patient is HIV positive. To further merge up with the other condition that didn't know that was positive, has not been on treatment, the immunity is very low. So again, these patients we find them when they are positive for TB cultures and all the symptoms. When the tests are done, chest x-rays and all the requirements to fulfill as a TB candidate all come up to be positive. Malaria, commonly prevalent in infants and children, has become, we see it as a disturbing problem, mostly in those toddlers and even in our pregnant mothers. In private facilities, we are seeing a number of mothers complaining of who are pregnant, who come and say, I was pregnant, but now I saw blood coming. When you test, you take up a malaria test, she was having malaria, which was not treated or poorly treated. And people are still having the routine to take fansidars, which we call IPT, which is intermittent preventive treatment, which they regard as curative, which is no longer curative. I think now we need to intervene by making the public aware of which drugs can help them in treating malaria.
So, Dr. Matov, what would be your general information you need to share with the public about how to know you have HIV or how to access service?
Now, unlike malaria and HIV, tuberculosis is special in a way that centers for testing and treatment are not generally distributed, are not available mainly in private facilities, although to some extent private health facilities can have testing centers, but they may not be able to recommend a patient to start treatment because these are people who need monitoring. Now, testing and treatment, the government has centralized it in health center 4s, right from health center 4s, not greatly in health center 3s, but coming the line of health levels up to health center 5s. The regional referrals, the national referral hospitals, and the district referrals, local health centers, health center 4s, 3 coming down, 1 can test, and there is always a signpost indicating TB is curable, test here and treat here. You can reach those facilities to test and treat for free for tuberculosis, as well as HIV. For it, we know that it can now be done from all local health centers, although treatment has to be sought from a higher and advanced health facility. Usually we recommend the government or the public health facilities, because more routine monitoring of the blood immunity levels, the CD4 counts, T4 lymphocytes, the immunity cells has to be monitored in line with the treatment that the patient has to take. Furthermore, to emphasize that today we want to move to a step, or we are on the step of evidence-based medicine, EBM, whereby please the public and all the community need to treat where there is evidence. Let tests be done on malaria before you take a drug. How be it that you are taking a drug which is not the right drug for your treatment?
Bearing all the information we have heard from the doctor, one of the raga singers, Shabaranks, had his song.
So watch this. On a wrong.
Thank you for listening and learning for TB, HIV, AIDS, and Malaria Free Uganda. For more information, dear beloved listeners, about Radio, Television, and Film Center, consider visiting the RTF platform online or at our physical address in Lubaga near Sedena Garden. We are always welcome, we always love you all, and we stand together as a team for our nation. God bless you all.